Hello, my name is Dr. Brad Bengtson from Grand Rapids, Michigan, here at the Bengtson Center. And we're continuing our webinar series on what does state-of-the-art breast augmentation look like today in 2021. What we'd like to do is just review a little bit of what we spoke about last time. I would recommend we did a really deep dive on patient education, implant selection, a little bit about the implants, those what we covered last time. I really do believe that probably is the most important of the different aspects of the process of breast augmentation that we spoke about last time. So I do just want to briefly review what we spoke about as far as implant selection. So really the state-of-the-art breast augmentation first starts with tissue-based planning. So I'm going to have Haley just bring up a PowerPoint slide. This is a patient of ours that has undergone Vectra imaging, and Vectra, along with some other things we'll chat about in just a second, really allows patients to visualize potential outcomes before surgery. And instead of just randomly choosing an implant, like my friend had this size or whatever, the most important thing to understand is your outcome is based mainly on what you bring to the table. So how much breast tissue you have, how symmetric you are, what your nipple position is, all those sorts of things really is what really creates the final outcome. So with this Vectra imaging, we can really very specifically measure some really important things, particularly the width of the breast and kind of the elasticity of the breast. And we use that based on doing what we call tissue-based planning. And I will choose an implant based on that range. So we don't like to go above or below about 1 centimeter. Secondly, so we can advance off of that. So secondly, the most important thing is about 200 cc's is 1 bra cup. And so that's important to kind of understand the range. So there is no standard bra cup size, as you guys have probably figured out. Victoria's Secrets, they're no longer a bra manufacturer, they're more of a fashion designer, a lingerie line. So you can't really base your bra cup size on that, and there really is no standard. So a friend of mine, a plastic surgery colleague of mine, and I standardized the bra cup, studying about 15,000 patients about 5 years ago. So we'll bring you in, we'll do a measurement across the hemicircumference or the outside top of the breast and be able to tell you exactly what bra cup size you are to our standard. So now we're starting at the same starting point, and then we can kind of go up from there. In general, about 200 cc's is 1 bra cup. But then the Vectra imaging really dials in the imaging and allows you to actually visualize or see what your outcome can look like with different implant size, and we can really kind of name and claim different bra cup sizes. It's just an absolutely fantastic experience. It really has virtually eliminated revisional redo surgery for size change, because patients really get to visualize and experience what their outcome is before surgery. So it's just probably one of the most significant things that has really contributed to great consistent outcomes in breast augmentation. So today what we want to do is move on to some of the other important aspects that really make a breast augmentation state-of-the-art. The next thing is the surgical aspect. So what we do in surgery, Dr. Alfonso and I do between 300 and 500 breast augmentations a year. The average surgical time is about 30 minutes in the operating room. To put you off to sleep, get your prep and break, it's about an hour or so, something in that line. And then patients are usually here for about an hour following surgery, and they can go home. Some of the critical aspects of what makes this very consistent and with great surgical outcomes with minimal complications is absolute meticulous bloodless surgery. So we place the implant through a small 1-inch incision underneath your breast, so right in the crease or fold of the breast. Placement through the armpit and or around the nipple, we don't do anymore because of the increased complications that can happen either with malposition, or it's difficult to create a nice precise pocket through any other position besides the fold or crease. And then capsular contraction, which is the #1 complication with breast augmentation, is extra scar tissue around the implant. So that basically, when you put the implant through the nipple, each breast contains, about, a lot of bacteria, and we can culture that bacteria out of 85% of women's breasts. So we want to avoid the breast tissue by going underneath the fold. We can kind of lift the breast tissue up. We're typically placing the implant deep to the muscle partially, and so it's separate from the breast tissue so it doesn't get contaminated, and then that capsular contraction or extra scar tissue is very low. But the critical thing is we've modified some lights and instruments to elevate this breast pocket and create the pocket perfectly to fit the width of the implant. So I have a breast implant here. When we place it in the pocket, we want to limit the medial or the inside dimension or location of the pocket, as well as the outside location. And what we want to do is match each individual patient's breast width to an implant width, and then we can adjust the size based on projection. But why that's important is one of the most common complications is malposition of the implant. So if the pocket is dissected too far in, implants can actually touch in the middle. If it's dissected too far out, it can kind of go out to the side. So really important to really dial in this pocket and limit the borders, the width and the outside and the inside where the implant is. We can allow the implant to move up and down in the pocket, particularly up in the pocket, but we don't want it hypermobile in that area because then we're going to need a revision. So we do that basically under direct vision. So we modify some different instruments to coagulate every little blood vessel that we see in the pocket before it bleeds. And that is really critical to the outcome. So when we wash and irrigate the pocket out, it's completely clear. There's not one drop of blood in there. When there's less blood, there's less pain, less swelling, quicker recovery, and it leads into the fast track recovery, which we're going to talk about next. But that really is just one of the most critical aspects, the second most critical aspect. And when we pop up the PowerPoint here, this is just an image of a 1-inch incision. And so we do a no-touch technique where we take the implant out of the box, it goes directly without touching the implant into this Keller funnel, which is a lubricated funnel that allows us to push a larger implant through a smaller incision without being contaminated from the skin, because the #1 area of contamination is either from the breast pocket or actually from the skin. So we push this device through into the pocket that's been precisely created for your specific implant. By the way, my scrub tech calls this the funnel of love. And so you can kind of contemplate that, I guess, a little bit. So the next thing we do is we irrigate the pocket with an antibiotic solution and some dilute betadine. So that is really critical as well to help prevent some of the bacteria that can cause the capsule and really limit infection, which is extraordinarily rare for immediate infection or anything with breast augmentation. So that is really important. And then finally, before we close, we actually block the ribs and the area with a long-acting Marcaine, which is a local anesthetic. And that provides pain relief for the breast. And it really is kind of changed the pain to more of a pressure feeling that patients have versus any acute pain. So we block the incision site and inside the pocket. And that has just been fantastic because it allows patients just to recover much more quickly with our fast track recovery and almost pain-free. It really is more of just a pressure feeling like your milk has come in if you've had babies or kids. So that basically is the meticulous bloodless surgical approach technique and Marcaine blocking and local anesthesia administration that we do. That all leads to and sets up the next important aspect is what we call fast track recovery. So breast augmentation today, the state of the art is to recover within 24 to 48 hours. And the vast majority of patients, probably over 90%, feel good enough to go out to dinner the night of surgery. So you should have very minimal pressure, very minimal discomfort, allow you to really re-engage with your life and family as quickly as possible. We allow patients to lift so they can actually lift, do kind of this curl thing. So with kids and babies, we allow patients to lift their kids immediately, anytime after surgery. And then most importantly, we have patients really kind of stretch and lift their arms above their head. So just again, back to the PowerPoint here. This is, by the way, after the implant has been delivered into the pocket. You can see the implant. And we also cover the nipples up and also paint the incision line with additional prep solution to avoid any contamination. We'll talk about the sheath in just 1 second, but we have an immediate range of arm motion. So we really want patients to be able to lift their arms up over their head. They're not going to move anything, hurt anything. The more active you are within reason, the faster you'll get better. We limit patients' activity a little bit, so you can do some non-impact activity like elliptical, stationary bike, walking for exercise, usually within a few days after surgery. About 1 month before we allow very high impact, full activity, push-up, bench press type activity. So that's the general kind of routine recovery aspects. But the state of the art today is no longer 2 to 3 weeks of pain and just off work and all the different aspects of things. All the time I give patients some extra business cards because they're very surprised. A lot of their friends, their experience is totally different. And so we really encourage them to be very active and basically just let them know this is what the state of the art recovery is for breast augmentation. So the next thing is the sheath fit, and I'll have Haley put this image up real quick. So I've been working with sheath fit and Bob Moylan here from the West Michigan area on a surgical sleeve. It's kind of like a tube top that is applied in surgery, and it has really been fantastic. So one of the things that we want to do after surgery is we want to get patients out of the operating room as quickly as possible into recovery. It's just much more efficient. And in the past, we would have to sit people up, oftentimes where they're still under anesthesia and trying to finagle getting a bra through the IV tubing, and the anesthesiologist is kind of lifting the patient or trying to get the bra on, and it's not the right size, and so it gets soiled, and so that's no bueno. And so what we designed is the surgical sleeve. Think about it like underwear, right? I mean, I always tell my sons, they may not wash their jeans for a month, but you need to change your underwear every day, right? So this is really just an undergarment. It's a very elastic, supportive surgical sleeve that is applied, and we actually put this around the patient's waist or legs, and then when we're done with surgery, we just lift them up and slide this up. It takes literally 5 seconds to get it up in position, and then we can get the patient safely out of the operating room into recovery. The other significant thing is SheFit we worked with to develop a whole system. So we actually have, it starts with the SheFit Protect sleeve, but then after a patient's in recovery waking up, then we can size them properly for a lounge bra. And that really is significant because you don't want a garment that's too tight or too loose because it's just not effective, or patients won't be compliant and wear it. So What we can do is after you're awake, we can kind of fit you into the lounge bra or low impact bra with SheFit, and then you have input into that feels good, that it's proper size and all that. The other thing that the ProTech does, it allows nurses to actually inspect the incision lines. What we found is if we put a patient in a garment, a really tight garment, particularly after body contouring procedures, the nurses are not taking that down or opening that up to look at the incisions. And if there's any drama, issues, complications, a lot of those are evident at the time of surgery while you're still in recovery. So this allows us to change your dressings, look at the incision, make sure everything's good before you're discharged. So we slip you into a lounge or low impact bra, and then you can go home. When you come back to the office, then we have the next phase, which is really more of the ultimate or higher end sports bra, a true sports bra. And we allow patients to start using that about 3-4 weeks when you start to engage in full activity. The SheFit device really is the most supportive bra that we've really found. And we've actually done some really cool research on the support and the degree of balance and stuff with the breast. So it's very comfortable. You can lock it in and size it to fit your body and breast perfectly. And I really do believe, we're starting some studies on this, that it can allow patients to heal faster, better, with proper compression, and particularly when we're doing revisional surgery and putting complex materials and scaffolds and things in, it really allows patients to get back to normal activity quicker and back into action quicker. And so we'll definitely talk to you about the SheFit when you're here, and that again it's really our third kind of state-of-the-art breast augmentation. The next thing that we'll go through, and I'll just show you a PowerPoint of this with a few things, is high-resolution ultrasound. So, one of my mentors is Jeff Foxworthy, and Jeff Foxworthy says, you might be a redneck if an episode of Walker, Texas Ranger has changed your life. And so for me, that's what high-resolution ultrasound has done to plastic surgery. I've been using ultrasound since 2006. I basically came up with it or thought of it when we were looking at 3 and 4D images of my son Nate in utero at about 28 weeks, and I morphed some images of his face inside the uterus, compared to 1 day old. And I was really surprised, even 17 years ago, how accurate ultrasound was. And so the first thought I had was, that is absolutely amazing, that image, and hello son, for the first time. The second thing I thought of is there has to be some sort of plastic surgery application to this technology. And so we really developed our own ultrasound system. We're changing that business really into more education and credentialing of plastic surgeons. But just now, high-resolution ultrasound is really taking off nationwide and globally. It's taken much longer than I thought, actually. But we've been using ultrasound for a long time. Starting about 2 years out, we just have patients come in and just scan their implant. We've incorporated that into their post-operative visit. While we're asking about their new dog and a new house, we're just scanning their breast implant. And I can tell you within 1 minute the status of your breast implant. I always ask patients that come from other practices, how did your plastic surgeon talk with you about following your breast implants over time? So most of the time there's no discussion about it, or they talk to me, I think I remember something about exchanging them out every 10 years, or I know there's like an MRI test that can be done. Well, insurance doesn't cover MRIs. They're at a minimum $1,000 and usually more to assess an implant. So that's not an adequate way to do it. And if it's not broke, don't fix it. So we can tell you, again, within 30 seconds to a minute, the status of your breast implant. So just on the imaging here, we'll just show this briefly. The reason why I'm so excited about the new breast implants is their level of cohesivity. You can see there's very minimal wrinkling and rippling, and the gel is so cohesive you can cut the implant in half and all the gel stays inside the shell like we demonstrated in our last video. So here's an ultrasound image of an implant shell. This is 1.1 millimeters thick. It looks a little bit like an Oreo because the sound wave comes in, bounces back, and cancels out the sound wave in the middle. So it actually is a uniformly thick 1.1 millimeter shell of silicone, but it just kind of is reflected back, so it looks like a railroad track or an Oreo. So how is this important? This is a patient who is about 10 years out from breast augmentation, and this is her MRI of her right breast. You can see the rupture on MRI of this $2,500 plus test. You can see the rupture on this view, and then of her intact implant on this side. So just a beautiful, nice, smooth contoured implant. Well, here's her ultrasound. So basically, we ultrasounded her, and her implant was ruptured right at the nipple level. So you can see it looks good, intact, and then boom, the shell has collapsed down in underneath, and versus the other side that's nice and smooth. So why is that important? First of all, again, the new implants are overfilled. So implants used to fail because they were underfilled and they could rub on themselves. Now the implants are overfilled. The ones that we use, the Allergan Natrel gummy bear implants, soft touch, or highly cohesive implants. So there's a very little chance the implant's going to rub on itself. We've been using this device for about 9 years now, and we ultrasound every single one of our patients, starting about 1 or 2 years post-surgical, and we image them every other year for life. It's included into our surgical fee, and there's incredible peace of mind and that when you know the status of your breast implants. There's no reason today you should not have a real-time outcome and result where we can demonstrate that your surgical breast implant's intact. So those are really I think the major advancements, again, in the state-of-the-art breast augmentation today. So it starts with patient education, and really spend a lot of time, about an hour total probably, with patients going through everything you need to know about the procedure. To properly inform a patient, you have to go through the alternatives, which there really are none. Fat grafting, patients come in all the time asking about that. Today, the state-of-the-art, fat grafting is not a replacement for a silicone implant. We can't get enough volume to actually survive to make more than about a half of a bra cup change. So it's very helpful in revisional surgery to smooth out kind of the surface of the implant, cover wrinkling and rippling, or like in breast reconstruction, fill in a lumpectomy defect or irregularity. It's very good at that. It's not a surgical replacement. But we go through all the options, the incisional options, all the potential risks and complications, the anticipated recovery, and then we go into actual implant selection. So sizing, we spend a lot of time with patients on that with our vector imaging. And I would just have you review the last webinar we did. We did a super deep dive on that. So I think that should be very informative. And then we phase into now the surgical, meticulous surgical procedure. State-of-the-art today is absolutely bloodless surgery, minimal swelling. There's a little bit of swelling from the muscle kind of contracting around the implant. It doesn't like anything underneath it. So there is a little bit of an upper pole bulge. And depending on the tightness of the skin in the lower part, it does take a number of months before the implant kind of gets into its final position. But size-wise, essentially what you see is what you get from day one. And then The importance of the surgical sleeves and post-operative surgical bras and garments are really critical. And then going into the fast track recovery program, very critical for you to be very active. We want you to get back into your routine as quickly as possible. I personally don't believe a patient can create a major complication, I mean, within reason. If you go out and do bungee cord jumping or something crazy, directly after surgery, then that could be one thing. But with normal kind of low-key activity, I don't think there's anything a patient can do to cause a complication if the surgery is done correctly. And then, so that fast track recovery program is really important. And then really follow up with high resolution ultrasound. We can ultrasound patients at any time. A number of patients will unfortunately get like in a car accident, or their dog will pull them down, and I've had a couple patients with rib fractures, and will come in and worry about their implants. And as we spoke about last time, they can really withstand an unbelievable amount of trauma, including a Porsche running over it. So we're going to do a video this summer with my new Ford F-150 running over an implant. So we'll get back to you on that, but I think they're going to be able to withstand even that amount of pressure. So, but I do think peace of mind with breast implants and following up with your plastic surgeon, after surgery is really important long term. So I hope this has been useful and helpful for you. If you have any questions, let us know. And I think probably the next breast focus webinar we'll do is we'll actually just inquire with you guys what are the most commonly asked questions about breast augmentation, and maybe in a few weeks we can basically just respond to those. So it's great being with you. I hope you have a great day, and stay healthy and happy out there. Take care.